Good morning, everyone. My name is Cordell Walton with CareWorks Comp. I am a program manager and I've been with CareWorks for just over 5 years. And before we jump into the PowerPoint webinar here today, I just want to give you guys a little bit of background about myself and really how I got to be here. So my background is in environmental health. I actually started out working for the local health department in their Healthy Homes division, and my primary responsibilities was to conduct lead testing and sampling for families that had children with elevated levels of lead in their blood. So my job was to go out, look for those exposure sources, and come up with ways to help mitigate those exposures. And my, again, primary role was centered around lead awareness and lead abatement. So I did that with the health department. I then went on to become an industrial hygienist, which basically means I went into manufacturing and construction sites quantifying workplace exposures. And those exposures were compared to the Department of Labor Occupational Health and Safety, or OSHA, regulations and guidelines. So my primary responsibility was, again, the compliance side of exposures, of workplace exposures. And I noticed that when I started speaking with upper management about safety, that unless I could attach a dollar sign, I couldn't get much buy-in. So I then found CareWorks, and we actually have a safety arm. So that's where I started with CareWorks 5 years ago, is with our safety arm or division, which was centered around loss control, injury prevention, and really that holistic approach to risk management in a way that will reduce not only claims costs, but workers' comp premiums for employers, and also reduce potential OSHA or PERP incidences with those employees as well. And so that's my background. And today, what we want to cover is really understanding your workers' compensation savings program. So again, I mentioned I started with CareWorks Comp in our safety division. So that is really a leading measure to claims management, okay? And at CareWorks Comp, we use an integrated approach when we're managing workers' compensation costs and premiums for our employers. So we want to use a holistic approach to drive the best results. Okay, so we do that with a combination of safety training, prevention, and education, like what we're doing today. So about CareWorks, well, we are a third-party administrator in Ohio workers' compensation. Okay, so what really sets us apart from other TPAs across the state is really implementing and utilizing that holistic approach and including safety or loss control as well as unemployment, okay, with our services. So just to give you guys a overview or sort of a background of some of the terms that you may hear when you're involved in the workers' compensation system is the BWC, which most people are aware of. The BWC is the insurance carrier in Ohio. Ohio is a monopolistic state when it comes to workers' comp insurance. So the premiums are collected by the BWC, and all costs associated with treatment and some indemnity costs are paid by those premiums collected from the BWC. The Industrial Commission is an adjudicating body in which employers and injured workers will go to contest any claims. So, for example, if you are appealing a claim, you will go in front of the Industrial Commission to do so. The MCO is a managed care organization. The MCO is essentially a extension of the BWC. And what I mean by that is the Bureau isn't large enough to medically manage claims for employers across the state of Ohio. So they vendor out those services to 13 managed care organizations across the state of Ohio, CareWorks Managed Care of Ohio being one of them. And the BWC actually produces what's called a MCO report that grades the 13 MCOs across the state on performance. Okay, and those performance measures things like the speediness of forward reporting, and we found that the speediness of forward reporting actually reduces the cost of claims. Okay, so there are about 15 factors that the BWC measures for their BWC or MCO report, CareWorks being at the top of the list every year. Okay, so the third-party administrator is a little bit different from the MCO in the sense that we advocate for the employer. The MCO, being an extension of the BWC, essentially advocates for the employee because the BWC also advocates for the employee. So we as a third-party administrator, we advocate for the employer in a way that is beneficial to get the injured worker back to health and productivity as fast as possible. Okay, so the MCO advocates for the employee and the third-party administrator advocates for the employer. So also with advocacy issues, we also represent employers at the Industrial Commission hearings. Okay, so we, as a third-party administrator, have 17 hearing representatives across the state of Ohio. They average 20 plus years of experience, and that's important because when you're going in front of the Industrial Commission, these are very short hearings, and our hearing representatives have a relationship with the hearing officers across the state, which helps to win hearings in the employer's favor because we know what they're looking for, what they want to hear, what type of information or documentation they want to see to make a decision. So that's the BWC, MCO, TPA side of the workers' compensation system. Now, when we talk about the responsible parties in the workers' comp, we have the sponsor, which in our case is the Ohio Fire Chiefs Association. They actually have the group put together the group rating program that the employer can participate in, and you have also the injured worker, which is a part of the workers' compensation premium calculation and system moving forward. So speaking of the employer or the employee, from a race and underwriting standpoint, our employees have a manual classification code, which is a 4-digit number that is assigned by the BWC based on the industry type. And each manual classification code represents a certain degree of hazard. The higher the hazard, the higher the base rate for that manual code. Okay, so for example, most of our manual codes for our association is 7710, which is fire patrol and protective corps and drivers. which is how the BWC classifies our industry group or a majority of the job codes in our industry group. And again, those will determine how much premium we pay because they get assigned a payroll associated with it along with the base rate. Okay. And when we're talking about reporting payroll, we're looking at gross wages, overtime pay, any commission that your employees may get, holiday and vacation pay, as well as any tips. Okay, so that's what we're looking at in conjunction with any segregate payroll by manual classification. So that's what we're looking at when we're looking at that premium determination. We're looking at the payroll, the manual codes, and we get a certain number that the BWC says we're going to have in claims losses. So again, experience rating. So we talked about manual codes and base rates. Again, manual codes are what describes our job categories. Base rates get assigned to those manual codes. And we essentially, as an employer, have what's called an experience rating. That experience rating really determines if we are doing better than industry average or we're doing worse than industry standards. And in this case, we are comparing to what the BWC expected us to have. So let's say, for example, the Bureau expected me to have, let's say I'm a facility with 10 employees. And based on the 10 employees payroll and the base rates assigned to those job codes, let's say the BWC says, hey, Cordell, we expect you to have $5,000 in claims losses or claims costs over your 4-year experience period. And I actually have, over that 4-year experience period, $5,000 in claims losses. Well, I'm essentially doing not better or worse, but I'm performing at the industry average. So if my claims costs were $7,000 and the BWC expected me to have $5,000 in claims costs, well, I'm essentially doing worse and I'm penalty rated. If I have $3,000 in claims costs and the Bureau expected me to have $5,000, then I'm essentially credit rated. So again, this calculation is over a 4-year period, with the most recent year being what's called a green year or a developing year. So for example, right now we are in the 2019 policy year for the BWC cycle, okay? And the 2019 policy year includes all of our claims that were sustained, not from 2015 to 2019, okay, but from 2014, right, to 2017. So it would include 14, 15, 16, and 2017. That would be the 4 years that we're looking at, with 2018 being the most recent year or developing year. So that example that I just gave you based on what a good performer looks like or versus a bad performer, this is essentially a example of what that looks like. So let's say what a poor performer looks like in the BWC's eyes. Well, when I talked about claims costs, that is essentially what TML, the BWC considers to be a TML. So instead of using total modified losses and limited losses, we're just going to say what we had in claims costs versus what the Bureau expected us to have in claims costs. So if we look at our first example, our TML, which is our actual claims cost, is $160,000. That's what we actually had over our 4-year period. The Bureau expected us to have $120,000 in claims costs over that 4-year period. Well, the formula that the BWC uses would essentially make us penalty rated by 33%. Now, if I'm a good performer, my total modified losses or my actual claims cost is going to be lower than what the BWC expected me to have. So in the second example of a good performer, our total claims cost over a 4-year period is $100,000. The BWC projected us to have $250,000 in claims costs over a 4-year period. Because we had significantly less, we're 60% credit rated. Okay, now that's an example of what a penalty rated premium or penalty rated employer looks like versus what a credit rated employer looks like. Again, having less claims costs than what the Bureau expected you to have over that 4-year period. Now, what are the advantages of having a credit rated or being a good performer? Well, that allows us to take advantage of certain savings programs, the most popular program being the group rating savings program. That is an upfront discount program that allows small to mid-sized employers to combine their credit rating to achieve an even greater credit rating or discount rating in a group. So let's say, for example, I'm 20% credit rated on my own. When I joined the Ohio Fire Chiefs Association's group rated program, I could actually turn that 20% on my own to a 53% discount or credit with the group. So if that is of any interest to you, we are in the enrollment cycle for the upcoming policy year that starts July 1. If you have more questions on the program or you want to join, please do so by November 15th. That way we can ensure that we get you into the group. Now, there's an alternative program called the Group Retrospective Rating Program. Unlike the group rating program, it's not an upfront savings program. It's actually performance-based. And the discounts are distributed after the policy year. So employers receive discounts 12, 24, and 36 months after the retro policy year is over. Now, the benefits of the program is that it can be higher savings than what's in the traditional group rating program. Now, what some people look at as a downside of the program is that if the program doesn't perform well, instead of getting a discount or a rebate from the BWC, employers would actually receive a invoice for additional premium owed for that policy year. Now, with CareWorks, we've never had that happen with any of our retrospective groups because we do such a great job with the overall performance of our group, from an educational to a management to a leading measures. We really put in cost control measures to drive productive and efficient results. So we have currently 10 members participating in our group rate and savings program with the association. And on average, those members are saving $1,292 off of their BWC premium. Now, we measure return on investment by the amount of savings the group has in comparison to the administrative fee to participate in that program. The return on investment for our group is 569%. So how do you enroll in a group rated program? Well, first off, you have to receive an offer from the third-party administrator. How do you do that? Well, you have to authorize a quote. The BWC calls this an AC3, or authorization to receive a quote, and it's essentially a form that just allows temporary and limited access to your BWC policy and experience in order to generate enough information to present a qualifying offer. And with CareWorks, you will be reevaluated every single year to make sure that you're receiving the highest discount tier as possible. For employers considering the group retrospective rating program, same process. You have to receive an offer. However, the deadline to enroll for the traditional or the retrospective group rating program is January 24th, 2020 versus the traditional group rating program deadline of November 15th. So the best way to manage a claim is to prevent it, right? Safety is all about prevention. So we encourage our employers to maintain a healthy, productive relationship with the employees in which there's communication, there's buy-in from upper management, and there's a way to get both sides, upper management and employees, to communicate in an effective way to bring about potential issues or to make corrective actions. So again, safety and prevention, you always want to make safety a priority. Create and communicate that safety plan with your employees, as well as have a established location for treatment of injuries and a process for reporting those injuries as well. The faster we can report and treat those injuries, the more costs we can save for our employers. So we call injuries or incidents injuries from a claims perspective or from a safety perspective, but once they hit the workers' compensation system, those injuries are now claims. And there are multiple types of claims. We have medical-only claims, which are typically minor claims. Those are your cuts, scrapes, and bruises, as I like to call them, in which injured workers are going to the OC Health or urgent care and leaving the same day, and potentially returning work the same day or the next day. Those are going to be your smaller claims in terms of cost. I believe on average, the cost of a medical only claim is typically lower than $1,000. It's typically between $500 to $700, depending on the industry group. Lost time claims, however, are much more significant in claims costs. They typically have or associated with 8 or more calendar days of indemnity or disability, and there are reserves in which the BWC puts on those claims, which could affect your premium. And what I mean by reserves is, let's say I have a shoulder injury and I go get my first set of treatment. There's costs associated with that first set of treatment, but the Bureau says, hey, since it's a shoulder injury or a rotator cuff, we're going to tag an extra $30,000 in reserve costs, which will impact the premiums paid by that employer until those reserves are removed. Occupational diseases are what I try to prevent and what I monitor for as an industrial hygienist, in which those are claims where employees contracted disease chronically or over the course of their employment. And these are typically associated with the overall air quality of the facility that they're working in. So I touched on cost control measures and holistic approach to workers' compensation. And for us, that's really a combination of these measures that we see here. We have safety, right, which is our leading measure for claim prevention. We have things like salary continuation, which is something that we do for our employees if it makes sense financially for us as an employer to pay their salary instead of letting the BWC pay wages for that employee, in which those costs associated with the wages the Bureau pays actually impacts us negatively in that they are added to the cost of the claim. Vocational rehabilitation, we have someone actually working with our injured worker, a voc rehab specialist working with our injured worker to get that employee back to work. Handicap reimbursement is where we look for one of what the BWC has established as pre-existing conditions that will allow us to take costs out of that claim. And handicap reimbursements essentially means that there was a pre-existing condition which exacerbated that injury and added more costs. So the BWC will in fact take costs out of that claims. So example is, let's say I'm injured and I have diabetes or arthritis, which could exacerbate that injury. Well, the BWC will give me a certain percentage of reimbursement, 10%, 20%, 30%, depending on the severity of that injury. Accident investigation is very, very important when it comes to involvement in the workers' compensation cycle or process when dealing with a claim. Now, we as a TPA can't go out and conduct the accident investigation, but we will work with the employer to provide steps to document for an accident investigation. Example being, was working with an employer over the last year, and they actually had a employee come into work on a Monday morning, and that employee said that they were injured working on a ladder. Now, this was a cable installer, okay? And that employee said they had to work on a ladder, a 12-foot ladder, to reach the cable box, and they fell off the ladder and tore their shoulder. Well, the safety person contacted me and said, hey, Cordell, we had a guy come in on a Monday morning and say that he fell off of a ladder. Now, Monday morning claims are notorious for being associated with some sort of fraud or negligence on either the employee's part or just negligence in reporting something that happened potentially last week, so, or the week prior. So I spoke with the safety person and said, hey, let's go out, let's do an accident investigation. I need you to go to the job site that they said they were working, take pictures, and interview any witnesses or any employees that was working with them. Well, he says, hey, he didn't have anybody working with him. He was by himself. He just went out there to finish up the project and go to this next one. I said, okay, that's fine. Well, I still want you to go out and at least take pictures. So he goes out and he takes pictures, and he calls me later and shows me the pictures. The cable box that the injured worker was working on was actually only 5 feet off the ground, and it wasn't on the second level. So what that means is that the employee did not have to use a ladder. So they, in fact, could not fall off a ladder during the process of working. So we took that information, we shared it with our hearing representative. Our hearing representative went to the staff level hearing officer at the industrial commission, and we got that appealed and overturned. So that was potentially a significant claim that would have affected their status for group rating eligibility. Okay, so we want to do accident investigation. Transitional work is something that will really help to, again, get our employee back to work so they're not sitting at home and that they actually feel productive. Settlements are things that we may look at for severe claims in which may last for multiple years. We typically look at settlements for members participating in our retrospective program to really cut the cost off of that claim and make it a fixed cost, so that way employers are not impacted by that claim moving forward. Subrogation will really allow us to take costs out of that claim as well due to third-party effects on that claim. So again, accident investigation, the most important thing that you want to do is document. You want to document the investigation, you want to get photographs, you want to utilize reports, written statements, because we share that with our hearing representatives. They take that in front of the industrial commission when we're fighting claims and appealing claims on your behalf. Salary continuation is, again, the event where employees or employers can pay the employee or injured worker their normal salary instead of letting the BWC pay lost wages for them. Now, we conduct studies, or what we call impact studies, to see if it's feasible for you as an employer to do something such as salary continuation, to utilize this specific cost control technique. Transitional work really, again, helps that employee or injured worker return to work gradually until they get to full duty. This lowers the cost that is attributed to claims, because again, when employees are off of work and not working, either the BWC is paying them those lost wages, or if it makes sense, you will be paying them their normal salary. Okay? And those are only in special cases. But essentially, the longer the employee is away from work, the higher the cost of the claim. So we want to get them back to work as soon as possible in a way that is healthy and effective. Vocational rehab is essentially services that are focused around creating individualized programs for that injured worker, in which they are assigned a case management professional to get that injured worker back to work. Okay, now this is a voluntary program, so the injured worker is not required to participate. We talked about settlements earlier. So again, when we want to identify when appropriate the ability to settle claims to eliminate the reserves and to prevent future payments on that specific claim. Okay, so once we settle it, we're effectively ending all costs associated with us and an employer with that injured workers claim. The BWC has identified 26 pre-existing conditions that have been proven to exacerbate or increase the severity of a claim. And these are the pre-existing conditions. Subrogation is a type of third-party recovery program in which we can essentially get money back on our claim or get costs taken out for our claim based on a third party, right? Because the BWC essentially looks at the employer as the responsible party for any claims or injuries associated with their employees. However, there are cases in which are completely out of the employer's control as well as the employee. Let's say, for example, you're driving to pick up material for your facility. It's work related, and out of nowhere, a semi runs into you, runs a light, or let's say a van runs a light and runs into you, and now you have been injured, you've been involved in a motor vehicle accident. Well, it used to be that employers were negatively impacted by that claim, and those are typically more costs associated with those type of claims, motor vehicle accidents, than others. So in the past, that have actually been the cause of removal for group rating status or eligibility for employers. Well, now the BWC has passed a rule for third-party motor vehicle accidents that actually started July 1, where they say there will be 100% subrogation for third-party motor vehicle accidents as long as you can prove it was a third party's fault. And I want to kind of finish up here with some BWC updates. I want to give you guys a reminder on the True Up. The BWC annual True Up deadline is approaching for August 15th. Okay, that is the process in which employers report their actual payroll for the previous policy year. And that is done electronically on your BWC account online. The billion back, the governor has passed on another billion back for employers across the state of Ohio. This year, billion back is resulting in an 88% rebate of paid premium for the 2017 policy year. And those rebates will be issued in September. The BWC did make premium changes. You know, anytime we get a new governor in the state of Ohio, we always get a new head and administrator of the BWC. Our new CEO and administrator of the BWC is Stephanie McLeod. She has announced for the 19 policy year a 20% reduction in base rates for employers. Now, that 20% reduction in base rates will result in a reduction in premiums paid to the BWC. It will also result in a reduction in the amount of claims costs or losses the BWC expects you to have over that 4-year period as well. So I implore employers that safety, communication, and culture is going to be much more important moving forward. And what I mean by that is promoting safety, communicating with your third party to come up with cost control measures to keep costs out of your experience. That way you are negatively impacted by future claims. And then the BWC does have a rebate for going green and paperless. You can receive a rebate if you decide to opt out of paper emails or paper mail from the BWC. So with that said, my contact information is attached below. Please feel free to reach out to me with any questions that you have moving forward. If you have any questions on some of the topic or would like more information on any of the topics that we discussed here today, please don't hesitate to give me a call or shoot me an email with your request. So I thank you for your time, and I hope you have a great rest of the day.